We're so glad you're joining us this week for Tooth Talk with the Dental Diva. We have Dr. Sylvia here from Jasper Dental Associates, and today our show is going to be about gum disease and tooth loss. Now, this is something that can start affecting us as young as how?
I'd say an older child or teenage years.
But not
early.
not even into the teenage years. It can happen earlier than
Yes,
that.
it can.
And of course, follows all throughout our adulthood. As long as we have teeth,
Yes.
we're going to deal with that, those possibilities. Well, I'm just going to turn it over to you. And well, I'll start off with a question. Now, what percentage of adults have gum disease?
50% of the adults over 30 have gum disease. At 70, that it jumps up to 70%. At age 65, rather, it jumps up to over 70% of the population. So it's significant.
And this just basically comes from just day-to-day life. Just using your teeth to eat and do all the things they're supposed to do.
And we need them.
And we do need them.
To eat.
So prevention.
We go back to brushing and flossing, because gum disease or periodontal disease is caused by the bacteria that's growing in the sticky film on the tooth surface, and you hear us calling it plaque. Gum disease used to be called pyorrhea, and that may be something that a listener is familiar with. The old
I've heard that
terminology.
term before. It sounds nastier than
It does.
it does.
So periodontitis is what we use now to describe the disease, and it can be as mild as a form called gingivitis. And the gums are red, puffy, they bleed easily, and advances from there. The good news is when we see it at the stage of gingivitis, it can be corrected in most cases. If your parents have had gum disease, you may be more inclined to respond to oral bacteria in the same way. So oral hygiene, brushing and flossing, a good diet are still the first line of defense to fight this disease.
Now, gingivitis will progress. You know, that, as you said, that's the mildest form.
Yes, if we don't control the gingivitis by teaching a person how, or a family, how to care for the teeth and keep them clean, it can progress to mild, moderate, and severe levels of gum disease. And what's happening is your body is responding to the bacteria that are present and the toxins that are released, if you will, from the bacteria, and it creates inflammation. So the inflammatory response is almost as if it's backing away from the bacterial toxins. And so you lose support tissues, tiny ligaments, and bone that hold the teeth in place if we don't do something to stop it. It can never be cured entirely because it's caused by several different types of bacteria, and there's no medication that can wipe it out. It's also because, we have many bacteria in our mouths. We have a lot of them that exist naturally in our mouth, so we're constantly fighting to remove them mechanically from our teeth.
Right, and as you said, brushing and flossing I would think would be very important for gum disease, because that's really what gets down in those gum lines, around the teeth.
It is, but I would say that they're equally important.
Equally important, but that's my point. It is equally important to floss them as it is to brush them.
Correct.
Yes.
We recommend an electric toothbrush called the Sonicare in my practice because I feel so strongly about how effective it is to use at home. It runs for 2 minutes. It times and gives you vibrations to signal when you move from one section of the mouth to another. And if you're using this for the full 2 minutes before it shuts off automatically, you realize how long 2 minutes really is. And most people who are in a hurry to get ready for the day, you probably shortcut their toothbrushing time. I know I would be guilty of it as well. So 2 minutes of brushing at least once a day, preferably twice. And if you're having a disease problem such as periodontitis or gum disease, then you may need to be even more meticulous in removing the bacterial film from your teeth as a person who's healthy, otherwise healthy.
But the Sonic that you're talking about, it sounds like it's just a no-brainer. I mean, it does everything for you. It notifies you when to change areas of your mouth, and then it shuts off when you're done.
Relatively so. A person still needs to be coached in how to hold the brush correctly.
At the angle right and all that.
Just to make sure that they're hitting the areas that are important to clean. And what I tell children, and it can be used for adults too, is if your tooth feels like a fuzzy sweater, it needs to be clean. It needs to feel like a marble to the touch of your tongue.
That was always one of my mother's sayings. Oh, I've got to get home. My teeth feel like they're wearing sweaters.
Exactly. We need to make them like marbles.
Yes, yes. And now, as far as getting the bacteria and stuff out of your mouth, mouthwash, how helpful is that? After you brush and floss, of course.
The mouthwash that we suggest for routine care is a fluoride mouthwash that Listerine makes. But it doesn't have a profound effect on the bacterial levels in the mouth. It might have a minor effect. But again, brushing the teeth or mechanical removal of that sticky film the bacteria grow in is the most important thing, whether we're brushing, flossing, using a water pick, etc. And if a person then has a later stage of the disease, we may recommend different tools and medicaments, if you will, to help control the disease.
Well, now also, along with prevention, more frequent dental visits are very important if you're experiencing the gum disease, is to get in there and have it checked on more often.
If you've ever been told as an adult that you have signs of gum disease, it's critical that you are routine about going to see the dentist because, as you mentioned, the disease itself can have periods of active infection where tissues are destroyed, and then plateaus where it doesn't appear to be destructive.
So it runs in cycles.
Correct.
Kinda comes and goes. Well, it doesn't go, but
well, once the damage is done, it's difficult to impossible to actually repair it. So we're maintaining it. And once we're past gingivitis and we have mild, moderate, or severe gum disease, it requires different treatment. For example, if you have radiographic or x-rays that show me that calculus or tartar is below the gum line, then you need a different procedure. Everybody may have heard of the terminology scaling and root planing. And other different offices may have different terminology to use for the same treatment. But it's when the hygienist, or dentist in some cases, uses their instruments to go below the level of the gum line to remove the irritants and hard deposits that can often only be seen with an x-ray. So it's another reason to have consistent follow-ups. If we see active disease, bleeding, tooth mobility, bone loss, and other damage that we can see by a visual exam along with x-rays, then we may suggest what is called non-surgical therapy for gum disease. And again, it goes back to the scaling and root planing, which we use our instruments for, and you don't have the means to do at home. So once we remove all those irritants, we may suggest the electric toothbrush, a mouthwash that kills the bacteria. It contains chlorhexidine, and there are a couple of different brand names that are out there, Paradex, and the second one, I'm failing to remember the second one off the top of my head, but it kills the bacteria that cause gum disease and cavities. It also can stain the teeth. So we try to teach you how to use it, which will prevent so much staining while still having the effect of killing the bacteria. But if the choice is losing your teeth because you have gum disease and getting a little stain on your teeth that the hygienist can remove when you come in for regular checkups,
Right.
the choice is to have a little stain and let's keep our teeth.
Now, how do you avoid the staining as much with the mouthwash? Just rinse that with water after, or
Well, no, because you want the mouthwash to stay on your teeth
right?
to affect the bacteria. So mechanical removal of plaque before you use the mouthwash is important because that's really
Gives it less to stick to.
exactly.
Right.
And the Sonicare reduces the amount of staining as well. The electric toothbrush called the Sonicare, along with the chlorhexidine, both mechanically removes the plaque and sticky film, as well as killing the bacteria that cause the disease in the first place.
Well, it's so important that y'all know how, to help prevent this, because gum disease is the number one cause of tooth loss.
It is.
Um,
If you can picture, most of us have seen a skull with teeth still in it, in the jaw bones.
mhm.
And the bone comes up to a certain level on the root. That's what holds the tooth in place. And there are tiny ligaments that also tie the tooth into the bone. And we're covered with the gingiva or gum tissues that you see when you look in the mouth. So underneath that, is bone. And the inflammatory process that occurs with gum disease can destroy the bone that surrounds the teeth. So if there's less supporting bone, the tooth can become loose and mobile. If the bone is lost nearly to the root tip, almost always it's difficult to repair or restore, and you risk losing the tooth itself because regenerative or replacing the bone has not been developed as much as we hope to one day in response to the bone loss of the disease.
Well, very interesting stuff you're sharing today. Now, this next subject is something that I really want people to know about because I was unaware, when I was having issues with my dental health, how much it was affecting my total health.
Well, it
People
goes
don't
both
realize.
ways.
Right,
You're
right.
For example, if a person is diabetic, it can affect the way that our tissues heal. Collagen is not replaced as rapidly in a person with diabetes. So a person with diabetes may be more prone to having the inflammation in the first place. On the other hand, the bacteria present in the mouth may be connected to diseases such as endocarditis or cardiovascular disease. So it can affect our overall health, and it makes sense that all of our systems are connected.
It can actually affect your heart.
It can, but they believe that it can.
Wow, that is just, because I know when I was dealing with my dental issues or headaches, just general feeling bad. Of course, I realize if you have any infection, that can be a part of that as well. That's something else. We actually didn't have it in the show notes, but something else I want to touch on is once you get infection in there, if that goes bad wrong, what can that do to you?
Well,
If it gets really bad and you let your infection go,
if we're talking about gum disease alone, it usually is self-containing. In other words, the results of the gum disease are loss of your teeth.
mm-hmm.
And once the tooth is gone, the source of the infection is gone because there's nothing to stick to anymore. There are other dental infections that can certainly lead to massive swelling and infection in the head and face
Mm-hmm.
that can be life-threatening.
That's
So,
the point I wanted you to, that I wanted them to hear you say,
in
yes.
the mouth, with the origins in the mouth, can most certainly affect our overall health and can lead to an emergency room visit, and should if the swelling is taking a lot of the face.
Well, it can be some scary stuff with infection of
That's
any
scary.
kind.
When the swelling includes the side of your face and your eye, we always encourage you to go to an emergency room for IV antibiotics.
Right, because you're getting
You
in
need
pretty
to have
dangerous
a new
territory
dose.
at that point. I had going through my problems, didn't realize the infection was there because they hurt so bad all the time. I
Well-
didn't know anything extra had come up, and they said that it actually could have killed me had it been left untreated.
Well, the interesting thing about gum disease, it's called a silent disease because often you won't have pain from gum disease. You may have some discomfort. You may notice that your gums bleed. And as a result, you may think that you're brushing too hard and shy away from brushing when in fact the opposite is necessary because the gingival inflammation causing the bleeding can be corrected in early stages by actually brushing and reducing the bleeding over the next few days by removing the plaque again mechanically. So it can be counterintuitive. People think, oh, I'm bleeding, I shouldn't brush so hard. But it may be that a person is bleeding because they have signs of this disease.
Right, and maybe they just got to an area that they haven't cleaned properly before and it got irritated. I did learn a long time ago that the bleeding wasn't always meaning that I was doing something wrong.
Exactly.
That sometimes it's just tender. And gum disease, you certainly will have a lot of tender spots on your gums. But that makes it that much more, what you're saying, so much more important to get in there and brush. To make that...
It is. And we coach our patients at Jasper Dental Associates. We take care to teach them methods and techniques to improve their toothbrushing and flossing skills. Now, if you have a more advanced stage of the disease, we may encourage you to add a water pick to your regimen and a mouthwash that kills bacteria, as well as coming in every 3 or 4 months as opposed to every 6 months. And a lot of times we hear, but my insurance only covers twice a year. Well, the insurance company is not always benevolent. So we have to direct your care based upon what your needs are. And as a result,
Right,
you
not
may
just
need
what
to
the
be
insurance
coming.
company says you can have, what you actually need
need.
for your case.
And everybody's different. It's an individual problem. But we tailor our
Right.
treatment to the individual as well. All of the mouth may not be affected. You may have 1 or 2 areas of the mouth that are affected by this. And we will isolate our treatment to those areas. And again, all of what I do in our practice is non-surgical. There are more advanced cases of gum disease that require surgery. And in those cases, I refer to a specialist called a periodontist.
Mm-hmm.
And that dentist can provide a surgical procedure that helps reposition where the gums are over the bone and helps shape the bone so that it's easier for you to get to and clean and easier for that dentist to see with a surgical procedure to remove everything from the root surface. It depends upon how advanced your case is. We like to catch it in the early stages
So you don't have to
so
go
that we
there.
can manage
Yes.
it. And
yes.
you don't have to have that. But in worst cases, it's necessary, and it's, again, better than losing your teeth.
Well, yeah, because in my case, my teeth still looked beautiful. All the damage was below the surface,
A person can have
unseen.
no cavities and still lose their teeth from gum disease.
Yes, there was bone infection and gum disease, and it had just eaten them away from the bottom.
And when we say infection, we're serious. In some cases, we actually see pus in the mouth coming from this disease.
Oh, I got very terribly scolded about one mouth infection I had after I finally did make it to the dentist, and they informed me that could have killed me.
But the good thing is, even since I've been practicing, we're developing skills to help manage the problem, including...
Right, that was my negligence. That was being too stubborn to go, why is this hurting? Oh, it's just going to hurt, and just brush it off, when actually it wasn't just the normal pain of the damage that was going on. It was a pretty serious infection. So don't let these things go, folks, because it can get real serious.
It's hard for me to describe in words without some sort of illustration, but you're losing bone. and it doesn't come back. And it's very difficult to achieve any kind of regeneration in those areas, so it's really critical. There are tools besides the electric toothbrush that I've talked about, floss, a water pick, and a medicated mouthwash. Coming to see us more often, there is an antibiotic in a chip that we actually can place directly into what we call a periodontal pocket. And if you've ever had gum disease or heard about it, you will hear the word pocket. These are the measurements that the hygienist in most cases take with their instrument called a probe. And a probe is a tiny ruler, and it can slide in beside the tooth and down into the pocket of gums that comes up around the tooth. Kind of like a sleeve. If you look in the mirror, your gums are coming up around the tooth, and you can fit an instrument down alongside the tooth and root. Well, the higher that number is, the larger the pocket is, and the more bone that has been lost from around the root. So a periodontal pocket of 1 to 3 millimeters is what we consider to be healthy. But when we hear numbers 5, 6, 7 to 9 and 10, we know that that's the damage that's already been done in the bone surrounding the tooth. And those are the instruments and the data that we collect when you come in to see us to help us know what sort of treatment you need and at which stage the gum disease is.
And how fast it's progressing by
And how
frequent
fast it's
checkups.
progressing.
Because you come back and you check it again.
And, it can be controlled with meticulous care and some of the tools I've talked about.
Well, and don't just think, oh, it's a toothache, I'll have it fixed later.
Or nothing's bothering me.
Or nothing's bothering me.
They're fine.
They're fine.
Until they start
Yep,
moving.
I've done that,
Teeth are not
yes.
supposed to move.
I've done that. I've done all that. And it was a terrible, horrible mistake. And I hope this keeps our listeners from walking the same road that I've had to in the past several years, because I was always pretty meticulous about taking care of my teeth.
Well, and
I did not know what was going on underneath.
Well, let me add that you may have a tendency to develop the same response again toward the bacteria that are naturally occurring in your mouth. And one person may have a different response than another. And it's important, again, for regular checkups. The one thing that we can do in this business of oral health is to watch and intervene if we see something happening, whether it's a cavity or gum disease. So the checkups are important, even if you're feeling no pain. Something can be happening.
And another personal note, mothers, do not neglect your own dental care and concentrate only. Of course, you have to concentrate on your kids' dental care. Don't neglect yours as a trade-off.
That's right. Mothers tend to neglect
That's kind of what
themselves in a lot of areas, but I see it.
Because if I was going to pay for a dental visit, it was going to be for one of the children. Sorry, I had 4 of them, and that's just how it was, and it was a mistake because I ended up spending a lot of my time in their teenage years sick or in miserable pain from my own tooth problems.
Mm-hmm.
So it actually didn't help anybody.
We go back to prevention. And it truly is key. And I agree. I think mothers should take care of themselves because they have so many others to take care of.
Right, but that's how we end up in that bad spot of not doing it, thinking, well, I can do this for myself, they need it worse. And that's not necessarily always the case. Because I spent days and days where I couldn't do anything but lay there with pain pills. And that is not benefiting my children at all. Fortunately, they're all grown now, but the grandchildren are coming along, and it's the same deal. And one of them has naturally very healthy, strong teeth. One of them does not, and he's already having problems despite our efforts to brush and floss and get the sugar out of his diet. But kids go other places and eat stuff other people give them, so you cannot control all that. So prevention.
Yes, and everyone's different. Everyone is unique. And I'd like to add that no matter what you're doing, that you may still have some of these problems, and not to be hard on yourself. In other words, you may be brushing very well and still have some form of gum disease that we can help you with.
You know, I can honestly say I took very good care of my teeth growing up. My mother was, like I said, she had sweaters on her teeth. You know, she was pretty strict about that, and I always felt like I was doing everything I could to prevent problems. Not knowing my genetic history, being adopted, I just kind of always blamed it on that, without realizing that I could have done so much. Even if that is it, I could have done so much to slow it down or prevent part of it.
We hear my father lost his teeth, so I will too. It doesn't have to be true. We can intervene now, and everyone has an opportunity to keep the teeth they've had as a child for the rest of their lives. Now, I did mention in the beginning that people over 65 have a 70%, the population over 65 has a 70% occurrence of some form of gum disease. As we age, the structures in the mouth change a little bit. The spaces between the teeth can enlarge and catch food particles more easily. A water pick may be the next tool in the set of seniors that need another tool to keep the bacteria and the plaque off their teeth, because we change as we age. And if we have other health conditions, it may be more difficult for us to either brush and clean our teeth, if we have Alzheimer's or Parkinson's or other forms of dementia that make it difficult for us to remember, understand, or even physically hold a brush. Or if we have changes in what we call the architecture of the mouth, including spaces between the teeth enlarging. So as our population ages, different needs are there that have to be addressed. But it is something that starts at an early age and then changes over the course of time,
Right.
with how we change as humans.
But I have to say, in my parents' case, as I've mentioned to you before, my mother is 87. My father will be 91 in March. And they both have most of their own teeth.
And we love to see that.
They both have just very small partials is all they wear that covers, one or two teeth. I can't remember. I think Daddy's is one and Mama's might be two. But at their age, that's just almost unheard of. But it's sad that that's so unheard of.
It doesn't have to be that way.
It doesn't have to. We can keep these. They were made to carry us through a lifetime. And we can keep them that long if we take care of them.
We can.
Well, all right. I want to thank you again to Dr. Sylvia, the Dental Diva, for coming in and sharing this useful information with us. Make sure you tune in to Tooth Talk with the Dental Diva every Saturday at 2 p.m. right here on your hometown radio station, WYYZ Jasper. And if you need a great dentist in the area, you can call Jasper Dental Associates. I'll have Dr. Sylvia give you that information.
Our phone number is 706-692-2611.
And they are family dentistry, so from the sign of that first tooth to 112,
Come
go
on in.
see Dr. Sylvia.